Hello everybody, and welcome to the Healthcare Information Technology Certificate Program here at Hofstra University. My name is Alex Belize, and I'll be your host for this webinar. Just move this over. There we go. So what we want to do today is basically talk about the certificate program, why the healthcare industry is an exciting industry to enter into. We're going to talk about some of the issues facing the healthcare industry, and we are also going to explain the certificate program and how this program is uniquely designed to benefit the students through the continuing education department here at Hofstra. So why study healthcare information technology? And as we go through this, please feel free to type in any questions on the GoToMeeting section on the right, and the moderator will hold on to the questions and we will get them at the appropriate time. So why study healthcare information technology? Well, first, the demand for healthcare is growing at twice the rate of the national economy. As the baby boomers continue to age and the government regulations continue to change, hospitals, providers, physicians, durable medical equipment, and laboratories are seeing an increase in the total number of services that are being provided. Furthermore, payments are being guaranteed by a number of the payers, which make the care more valuable for the doctors that provide the services. This is also leading to a shortage of qualified care workers in the industry. The industry itself is on track to create approximately 5.6 million new jobs by 2020, according to the Georgetown University Center on Education and Workforce. These jobs vary from both clinical to non-clinical jobs in terms of providers, as well as nurses, in which there's a significant shortage, but also ancillary services, which mostly relate to technology-related services, technicians, and people who can perform non-clinical functions to support the clinical care by hospitals and by doctors as well. Software companies are also looking to expand their opportunities, and consulting companies as well, into the healthcare practice because of the high demand. The growth in the industry is due to a number of factors. People are living longer and demanding better care. As the population continues to age, the demand for services increase, and as the industry turns to more consumer-based type of care, we see that the care demands that more services are provided at a higher level of quality. We can see this when we go into the pharmacy and you see things like Duane Reade or CVS or Walgreens that are constantly upgrading the way they communicate with their prospective patients for prescriptions by providing services such as drug interaction medicines, automatic refills, and coordinated care. Payers are looking to save money by increasing the quality of care. If people don't require expensive care because they're taking care of themselves better, the payers will actually save money from insurance premiums. But this requires examining what the habits are and how to improve care, and it's through the use of data that we see that payers are expanding their reach in terms of determining how to create better quality of care. Technology enhances diagnosis and treatments. New advances in technology, not just clinical but non-clinical, will help doctors in creating better diagnoses and better treatment options. Things such as the IBM Watson project, which is used at Sloan Kettering to handle oncology patients, actually determine the various symptoms and can actually predict what is actually wrong and where with the patient. Sloan Kettering is one of the more advanced hospitals, but other hospitals have begun to utilizing things like robotic pharmacies to actually fill prescriptions. Increased connectivity between providers and consolidation in the industry. So providers are trying to communicate the information about patients a lot better. You may go into a doctor's office in which they can pull up an x-ray from a local hospital and see the results immediately. We see this also with lab results from radiology that are automatically transmitted from doctor to doctor that go into their electronic medical record system. We're also seeing in the industry increased consolidation between hospitals. Some hospitals that cannot afford to stay afloat are being acquired by other hospitals, and we're seeing certain practices such as orthopedic practices, radiological practices, oncology practices being acquired by larger hospital systems. So you see these larger hospital systems being developed. And then finally, new regulations are forcing massive changes through every stakeholder. That means all the patients, the payers, the providers are all being affected by very complex and enhanced regulations, and we'll talk about a few of those. The healthcare technologies are involved in almost every aspect of patient care, from monitoring where the patient is, how the patient is doing at any particular time, to keeping an entire history. We see advances in wireless communications helping seniors in managed long-term care situations where blood pressure results or pulse rates or even insulin rates are actually transmitted wirelessly from the home directly to the doctor's office for better quality of care. Some of the regulations that are in place that impact this industry, obviously the Patient Affordability Care Act, also known as Obamacare in the media, is a fundamental change for the industry. It is now increasing the total number of people who are going to be eligible for health insurance. This means more people are going to be demanding more services, leading to an increase in the shortage of quality of care. So hospitals and providers are looking for ways to be able to handle those types of increases in services. The packet increases the number of people by approximately 10%. Government established healthcare exchanges for patients to obtain health insurance. So the federal government will actually be creating these exchanges, if not at the state level, where people can basically choose which health insurance company they wish to go to if they are unable to get insurance on their own through their company. These healthcare exchanges will require coordination of benefits, understand what benefits are available to a particular patient based on their situation and based on their region and what they are willing to pay for. This requires information being transferred between payers as well as between providers. The original American Recovery and Investment Act, the stimulus bill back in 2009, allocated $19 billion in stimulus payments to hospitals and providers for electronic health record implementations. Here, the government is providing incentives for providers and hospitals to implement these EHR systems. For doctors, it is approximately $45,000 per doctor over a 5-year period, and for hospitals, they get between 1.5 and greater, depending on what they service for Medicare and Medicaid payments. In order to be eligible for the incentives, their EMR system must be certified, and they must be able to prove that they meet the meaningful use criteria established by the Department of Health and Human Services. The Department of Health and Human Services has 3 stages of meaningful use: Stage 1, which has already been completed; Stage 2, which is still in work in progress; and Stage 3, which is yet to be defined. Requirements for health information exchanges are also being established. The health information exchanges are how providers will exchange their information about patients through a central hub. Basically, that patients, when they go to a doctor and they get a treatment, that record can be sent to a central hub, which can then be accessed by other doctors who might be utilized for a coordination of care if you went to, say, a hospital. So that if you ended up with an emergency situation and you went to a hospital, the hospital might be able to retrieve your entire medical history to determine whether or not there's any allergies or whether there's any particular information that is important to treat you in case of an emergency and in case they are not able to get that information. The whole purpose behind this is that the more information is available, the cheaper the cost of care will be, and the less chance there will be of incidences of risk whereby they provide a medication that gives you an adverse reaction or they're treating you for something that they shouldn't be treating you for. Additional requirements for HIPAA are also in place. HIPAA is the Health Information Privacy and Accountability Act, which has specific requirements on how private information is handled, otherwise known as PHI, personal health information. Changes to the coding systems, so we're moving from what's called the ICD-9 coding system to ICD-10. This is all placing a strain on healthcare professionals, and some of you who may have gone into either hospitals or doctors may have seen interesting changes at your office that you may not have seen a few years ago. So what are the opportunities that can be obtained by people interested in getting into the industry? Well, you can learn it's interesting to learn the industry. You have to understand the technology as well. From a provider standpoint, doctors, hospitals, labs, they're all implementing EHR system, electronic health record systems, and you'll see the terms in the media of electronic health record and electronic medical records interchangeable. They basically mean the same thing. And they're working to integrate systems with each other. So you will see certain hospitals try and integrate their EHR system either through a health information exchange or directly to providers that are within their network. Furthermore, consolidation in the industry requires that the systems are merged. When hospitals take over another hospital, the EHR systems must be merged as well, or at least the information must be synchronized and integrated within the entire system. Some hospitals are also creating separate groups dedicated solely to quality, such that they will collect all the data to determine how they can reduce readmissions or incidences of certain infections, which will actually cause them to lose money. It's important to understand that hospitals and payers get paid, hospitals and providers, excuse me, doctors, get paid differently from the government. Hospitals are paid on a fee-for-diagnosis schedule, which means based on the diagnosis they get a flat amount, so hopefully they treat you faster so they make more money. Whereas individual doctors get paid on a fee-for-service, which means they get paid based on the services that they render. Payers are also opportunities because they're providing a variety of services. Regulations are changing, and they have to meet those regulations. They require assistance to maintain their systems and create new systems for efficiency to meet these regulations. One of the things that the payers will do is they will have to be able to conform to both the original ICD-9 standard and ICD-10 standard, as well as changes in CPT codes that come from the American Medical Association every year. Each individual payer also has to comply with individual state regulations. New York has their own regulations that are different from, say, Pennsylvania or from Ohio, and thus payers who are in the space both in New York, Pennsylvania, and Ohio will basically have 3 sets of rules that they will have to abide by. Some of these include model audit rule, for example, in New York, which is very similar to Sarbanes-Oxley. Nonprofit entities are not bound, obviously, by Sarbanes-Oxley. Only public companies are. However, in New York, the health insurance companies are required to abide by the model audit rule, and as such, they will be required to provide some sort of financial assessment and health of their business without necessarily being audited by an actual firm. In addition, by the way, the payers are also looking to provide web portals so that you can get information about explanation of benefits, what benefits are covered, and they are seeking to reduce their costs by putting things online for consumers so they don't have to actually send any mail or any postage, and they can communicate more efficiently without having you call the call center. The public, which is a third, which is considered government, state and federal offices are upgrading their systems to ensure compliance with the regulations that they've set themselves. Some think that the federal government or state government makes a regulation and doesn't have to do much, but in fact they have to change their systems as well, and sometimes they fall far behind the industry, and they will have to upgrade their systems for reporting. So hospitals and insurance companies will have to create various sets of reports, and they will have to send those to the respective government agency. And as such, they will have to import it into their databases and then figure out if everybody is in compliance, and if not, how do they proceed. Software companies and consulting companies have recognized the enormous opportunity and have begun tailoring practices to provide specific products and services to providers and payers. So they will actually hire medical doctors, registered nurses, and technologists who understand EHR implementations, who understand things like data warehouse and business integration, as well as project managers and business analysts, and then provide those services to hospitals and payers who do not have the capability of handling that on their own. Some of the initiatives that healthcare companies are facing specifically, as we mentioned, EHR implementation. Obviously, when the providers such as hospital and doctors can meet the meaningful use criteria, they have an incentive to do so. In addition, if the providers and hospitals are not EHR compliant by 5 years, by the 2017-2018 timeframe, technically they will be assessed a penalty, a Medicare penalty, on their payments from Medicare. So some do not believe that will actually occur. It's still up in the air to see if they will actually do that, how they will do that. However, it's still listed on the books as a risk for the providers. The ICD-10. ICD-10 implementations are very expensive because the entire coding system is changing. It determines what fees an actual provider can charge for. So if you go in for an appendectomy, there is a specific code for the an ICD-10 code for the appendectomy. It used to be that it was a little bit more simpler. Now there are exponentially number of new codes in ICD-10 to get a better granularity of what is actually being treated what the actual diagnosis is, and what the treatments are. The ICD-10 coding system, it's estimated, can cost a company anywhere from a smaller insurance company from anywhere from $5 to $15 million for the overall implementation, and a larger insurance company over $100 million over a 4-year period just to be in compliance. Hospitals will have to change their systems as well for ICD-10. Where they need to be more careful is that if they bill for the wrong thing, they will not get paid on time by the payer. And if they bill incorrectly as well, they may not get paid as much money as they would be eligible for. So having coders who understand the ICD-10 format and understand what was actually rendered and what the real diagnosis was is extremely important. Out of the ICD-10 and ICD-9, you do see additional companies that are solely medical billing companies, and they too will require technology services as well. Another big area is data analytics and big data. A lot of companies, a lot of insurance companies especially, and hospitals are basically collecting these large, massive amounts of data so that they can analyze the data to increase efficiencies across the board, provide better diagnoses, potentially better treatments. By doing so, they can increase their payments from Medicare and thus generate additional revenue. Where it also becomes important is that this information is also used for pricing, both for underwriting risk and payers, but also the prices on fees for service for Medicare, as well as Medicaid. Those are geographically dependent and based on a number of factors when Medicare makes those determinations. By understanding all of the data, you understand your patients a lot better, and you understand where your significant risks are, and for the payers, they can basically try and head off any major problems later on before they actually occur. And so what they will do is they will create medical management practices where they can help manage chronic care issues such as obesity, asthma, and diabetes. And finally, telemedicine is another one where doctors can actually provide treatment, diagnoses, and potential treatments basically using video conferencing or WebEx, similar to what we're doing right now, where the doctor can get an assessment of the treatment, get an assessment of the symptoms, and then provide a diagnosis for the patient, so the patient doesn't actually have to visit the office, and yet the doctor can still get paid. There are other things that are going on with telemedicine, especially in the area of managed long-term care, where chronically ill patients are somewhat forced, but gently forced out of a hospital so that the chronically ill patient can be at home. The payers will then pay to retrofit a house so that it is a more comfortable environment for the ill patient. And what they will also do is have various monitors that will do blood pressure, can test for sugar, can test for a number of other factors. And then those devices, those clinical devices, are connected via a wireless network, which are sent then to the EHR system so that a nurse or a physician's assistant can monitor the progress of a particular patient and keep track of how the patient is doing. So what types of healthcare jobs, healthcare technology jobs are available in terms of the non-clinical? Well, we can separate it into basically two columns. One is specifically technology, and the other is more of an ancillary technology or technologist. Project managers are always required for these various large projects, and these are large projects. Business analysts, so they can understand the various workflow and processes that are within the hospitals and payers. Software trainers and writers. This is another big area where a lot of the systems are not well documented and do need to be documented according to new rules, as well as training in the EHR systems as new people come in, or training in various other systems like call center systems for a payer as well. Financial systems are also important. The billing systems, obviously, and the registration systems or bursar systems at a hospital, as well as the adjudication systems for payers. These might include things such as PeopleSoft. They may include Oracle, the older Oracle financials systems, as well as some custom-built ones and some others from Siemens and GE. Data analysts are always required to understand the various treatments and diagnoses that patients have. Payers will collect all the data and determine what their ultimate risks are and create underwriting risk triangles. Data analysts may also be used in various other ways to understand what the overall payments are, as well as to meet regulatory obligations. Regulatory and compliance, having people who understand HIPAA and understand all the other rules and meaningful use are important so they can begin to help make sure that the organization is in compliance. And there are many rules that have to be adhered to, and these are both at a federal and state level. And architects, software architects, data architects, information enterprise architects are also required to basically put together the whole system and understand how all the pieces are ultimately going to integrate with each other. These individuals sometimes have stronger healthcare backgrounds, sometimes they don't, but they definitely have a technology background and understand where the industry is going. They're usually 3 to 5 years ahead, saying this is where the industry we believe intends to go, and thus we need to make sure that our systems can comply. More technical jobs are EHR implementers, people who understand systems such as Centricity, Allscripts, even on the hospital side, Eclipsys and Epic. Software developers to develop things such as web portals or internal applications that will pull data and provide information reports for different departments such as medical management and risk and underwriting, or claims operations for an insurance company, or the registrar, bursar for a hospital or an oncology or radiology department or a pharmacy. Data warehouse experts, people who can build data models, people who can understand how the database is actually created and works. Integration experts with technologies such as BizTalk or Gentrain or the WebSphere suite of products, because information actually comes in an EDI format or HL7 format. These are two separate formats in the healthcare industry. EDI is one of the older formats, which is usually used for claims, and the HL7 format, which is based on XML, is used for clinical information between providers. Security administrators to lock down privacy of data and make sure that the network and infrastructure is secure. Security is extremely important, especially with respect to HIPAA. HIPAA violations can cost a company, hospital or provider, or any hospital or a payer or any other what they call covered entity a significant amount of money if a federal audit is done. Server administrators to ensure that the systems are operating at peak performance, and network administrators to provide the connectivity amongst all machines. So the Hofstra Healthcare program is basically designed to give students an edge in these healthcare jobs. And the curriculum has been put together so that basically they get the set of key healthcare information topics, as well as they are provided in some cases with an internship opportunity, which will provide some practical experience for those who do not have any in a clinical environment. Some of the students have received internships at the following organizations: North Shore LIJ, Winthrop Hospital, and Nassau County Medical Center, and we're constantly seeking additional internship opportunities for other students and other organizations that are interested in having them. 80% of our students have successfully completed all the requirements and have found employment in the industry. So we have a very high track record of having students actually take the information that they've obtained and actually acquire a position in either IT or in healthcare or both. So the certificate curriculum requires successful completion of 6 courses. 5 courses are required, and then there is 1 elective, and it's usually completed in roughly an 8-month period or 2 semesters. The required courses, and we'll go through these courses a little bit more detail, are Introduction to Healthcare Information Technology, which provides an overview of both the industry as well as some of the technological components for each of the 4 Ps, which are the providers, the payers, the public, which we consider government, and patients as well. Security, privacy, regulation issues in HIT, so we're concerned with things such as HIPAA and some security issues associated with hospitals and payers. Generally, you will see very strict requirements in financial industries, while those requirements are just as strict in the healthcare industry. Healthcare data warehousing and analytics. Here, students will learn a little bit more about modeling and how important data warehousing is in healthcare and what it's used for. We talk specifically about healthcare IT projects, processes, controls, and quality, where things such as ITIL are covered, as well as other types of processes and project management and what quality issues occur. And then electronic medical records implementation, so students are familiar with what an EHR system or an EMR system is and how that gets implemented and what are the key components of such. So 2 of the elective courses we have is Fundamentals of Health Informatics, which is a little bit more in the actual data components of health information, and Introduction to Healthcare Studies, which is an elective designed to give students who have less clinical background a little bit more understanding of anatomy and some of the terms that are used within the healthcare industry. So the introduction course basically teaches students how technologies impact the stakeholders, and what we talk about here is provider health systems such as the EHR system. We talk about adjudication systems for payers. We'll talk about the patient medical records, things such as, well, Microsoft Health Vault. It used to be another one was Google Health, but they no longer exist. And we talk about the issues relating in general government policy and oversight and how the industry changes with respect to the payment mechanism for hospitals, the payments for providers, and where the industry is going in general. The security class basically talks about the complexity and costs associated with securing the environment and data. Things that are talked about here are encryption. We talk about firewalls, how to secure an environment, internal controls, data retention, monitoring systems. And one of the focus here is to try and determine which people are required to see which sets of data. So for example, if a nurse has access to the entire system and can see every single patient's data, that could be a HIPAA violation. Most nurses, doctors, and other people who work in the healthcare industry become what are called HIPAA certified or HIPAA trained within their organization. They're usually required to take a half a day or a one-day course and pass a test. And basically there that you understand what you're allowed to see and what you're not allowed to see in terms of data. And the company is supposed to make every effort possible to ensure that no HIPAA violations actually occur. Some of the most famous violations of this include when the Representative Giffords was tragically shot, and in the hospital, I believe it was 4 nurses and a doctor were actually fired for accessing her information without authorization because they were not the doctors or nurses who were treating her. A similar situation occurred at Iowa State where the football team, 4 members of the football team fell ill during summer practice, and some of the physician's assistants had actually acquired data regarding that, and with the intent or the supposed intent was to sell the data to the media. And again, this was a HIPAA violation, and the hospital would have been liable for that. So they were fired as well. In the Healthcare Data Warehousing and Analytics course, students get an overview of data warehousing, OLAP, and consider analytics in healthcare environment. And so they learn how data warehouses are created, but they do so with the terminology and with the fields that you might see in a database from a healthcare industry, from a healthcare organization, a hospital, or a payer. They understand how the data warehouses are used for clinical analysis, government agencies, how reports are created for the various agencies, to understand how, for example, to determine the number of children that are considered at risk based on a series of criteria. From a New York State perspective, as an example. The additional topics include understanding ETL, best practices in ETL, best practices in database design for OLAP, as well as data mining. The Healthcare IT Projects, Processes and Controls Quality course provides an overview of processes specific to HIT and meeting regulatory and privacy concerns. So here they will talk about the ITIL framework. They will also touch base on COVID and general project management practices, as well as begin a clear understanding of the workflow between the individual clinical personnel as well as non-clinical personnel to deliver the high quality of system before it goes into production. Specifically for a hospital, they might run through a series of tests to ensure that systems implemented achieve the highest quality control. In here, the students will also begin to learn the complexity of implementing systems in a clinical environment, as there is usually some resistance to technological change. The Fundamentals of Health Informatics is a practical course that basically focuses on solving problems, coordinating resources, devices, and methods to optimize acquisition, storage, retrieval, and use of information in healthcare. So you talk specifically about the healthcare data itself, what the data components are, the best way to store them. We'll talk about medical imaging systems and the complexity of dealing with unstructured data, such as images, X-rays, CAT scans, MRIs, sonograms. Then we'll discuss here telemedicine and management of healthcare information overall. De-identified data is also important as well. De-identified data refers to PHI data or clinical data that has no significant identifier to a patient, so that you cannot tell who the patient is. And there's a list of 19 criteria that will determine whether a piece of data actually falls under the PHI criteria and therefore is HIPAA covered. The EMR implementation, again, incentives provided by the Stimulus Act are the driving force behind this course. EMR presents unique challenges to IT and medical professionals. You learn how to navigate the process of workflow analysis, benefit expense. They'll understand the pieces of meaningful use criteria and the clinical requirements configuration. And here, this is where I talk about the differences between provider implementations and IT requirements. In some EMR implementations, they're more rigid than others, and so the providers have to change their workflow. The ones that are less rigid, the system has to be more configured and modified to meet the workflow of the provider. The Introduction to Healthcare Studies provides students with a basic knowledge of anatomy. This is designed excuse me, for students who don't have a lot of clinical knowledge, so they can understand things like what the cholesterol numbers are, the systolic, diastolic from blood pressure, understand the differences between data elements, understand clinical systems, radiology, and understand how the different departments in a provider might work together. So some of the instructors here, myself, I am a professor of IT with the Zarb School of Business. I'm a former executive with a healthcare firm, Emblem Health. I was the enterprise architect there. Dealt with a significant number of providers as well, and I've consulted with a number of providers in Long Island. My research actually focuses on healthcare IT strategy, and big data as well, and I've been teaching for about 16 years. Lorianne Koleski has over 10 years experience with Emblem Health, insurance company. She is an experienced data warehousing teacher, understands data modeling, and understands information architecture, and handles the courses around data warehousing and informatics for us. Sharon Borzoni is from New York Chiropractic College and Hofstra University, massage therapist, and understands anatomy and provides the students with a very clear understanding of clinical knowledge required for information technology in healthcare. And finally, Jack Cronin, the project management consultant, and helps students understand things such as budget development, asset management, process reengineering within our program. He handles the process and controls aspect of the curriculum as well as project management. That kind of concludes the information that we have for the certificate program, and we have some questions. But before I do that, I want to make sure that everybody's aware that we do have an open house on January 12th, 2013 from 10 to 12 o'clock. That is a Saturday, and it is at the Hofstra University Club, which is located just north of Hempstead Turnpike. If you come into the main entrance, you make a right at the north entrance, and the Hofstra University Club is directly on your right. So with that, we'll take a few questions. So the first question, is it possible to complete this program while working full-time? The answer to that is yes. All of the courses are at night, and a lot of the students who take the course are either seeking new employment or do have jobs, and actually doing this full-time is not an issue. There are 5 courses. It is over 6 courses plus 1 elective, which are five required courses, 1 elective, which are over an 8-month period. So it is very feasible to do that. Is this a good program for nurses is another question. The answer to that question is yes, because this will provide a lot more technical foundation, which will help nurses. In fact, an interesting note is that another reason for the shortage of nurses is that some of the nurses are actually moving into areas that are more technologically based. And one of the things that they find is because the nurses have significant clinical knowledge, they are finding great opportunities in informatics, clinical data. So they become very good data analysts and can provide various departments with significant amount of information. They're also extremely valuable in EHR implementations because they act as the business analysts or the data analysts for the EHR implementations, which make them extremely valuable for the understanding of the challenges dealing with doctors and the workflow. Another question here, are there payment plans? The answer is yes. The person to contact there is Sabrina, S-A-B-R-I-N-A, and her number is 463-7200. And I think we'll have that posted on the chat on the side. If not, you can call our office here, and we'll get that information. Another question here, what if I have no healthcare experience and not very experienced with IT. Well, we take it two separate pieces. If you have no healthcare experience and you have some experience with IT, you will gain a lot of the healthcare experience understanding how IT is implemented. Now, if you don't have any IT experience, it's still a beneficial program because you will start understanding a lot of the terminology. You'll start understanding what these systems are. You may even find that you'll want to get a little bit more technical in certain areas. However, depending on your experience in the other industry might be very valuable for a healthcare company if you can bridge the gap between the two. Is it too late to register for this semester? It's not too late. I think we're still taking registrations for at least the next 4 or 5 weeks, a little bit more. Just call the office and they'll be Sabrina, and they'll be happy to help you with that. The next question is, I have experience in IT but not in healthcare. Do I need to take courses? To learn about healthcare? That's an interesting question. The answer to that is a lot of the healthcare companies, a lot of the healthcare organizations are looking for people with a little bit of healthcare background. So by doing a course or curriculum such as this, it gives you a slight advantage over people who do not have anything in healthcare. To understand what the healthcare terms are in an interview or in a seminar session with people who are in healthcare provides that lexicon that says, hey, I understand what's going on, and my experience in other industries can be leveraged, and here's what this means. While a lot of the technology, you'd find the same, it's important to be able to speak the language of the people who are ultimately the prospective employers. It is a very good field. It is a very stable field, and they pay pretty well. Do you consider, another question here, do you run courses during the summer to complete anyone? The answer is yes, we do. You can contact the office again for more information specifically on that, but we do offer those courses. That is the end of the questions. And just one reminder, again, there is an open house on Saturday, this Saturday, January 12th, from 10 o'clock to noon at the Hofstra University Club. And hopefully we'll be able to see you there. There'll be quite a number of our representatives here, and we'll be happy to answer any questions that you have. Are there any other last questions? No? Looks like we're all done. I want to thank everybody for their time, and hopefully we'll see you at the open house. Have a wonderful day.